The divide between good enough and getting it right has never been so great. But anyone can say they do what's right. At Mylan, we transform words into actions and simply say, see for yourself. See inside. See inside our innovation with more than 1,000 products worldwide. See inside our quality, an ingredient in each of the 45 billion doses we can manufacture. See inside our leadership, where we champion policy that can one day impact quality standards all over the globe. See inside our passion to bring life-saving treatments to those in need. See inside Mylan, because 7 billion people depend on our employees to get it right, and we refuse to let even one of them down. But don't take our word for it. At Mylan, seeing is believing.
Jim Langman, VP of Health and Wellness Operations, talked about the important opportunity to align Sam's Club's various clinical offerings with the other areas of the club.
I know, health and wellness is a strategic growth area for Sam's, and I know a key part of that is growing script count, as you say. Where do the extra scripts come from? Is it about converting existing members to pharmacy and getting them loyal to pharmacy, or is it about getting new customers? What goes into that?
Sure, there's a whole bunch of different things. If you just think back into what happens in your own personal life, everything from a doctor to your barber to where you get your car fixed. There's a barrier you want to break down of not knowing that person, not knowing the quality of the services you're going to get. And when you come into healthcare for clinicians, normally it takes 3 interactions between a patient and their clinician before they really feel comfortable in having a complete discussion with that patient and being completely trusting in that clinician. Once you go through that barrier, it's something you don't want to break through again, because you don't want to have to change that very, very important thing in your life, which is your health. So the great part about what we're doing is getting our message out, letting all of our members know that we have fantastic values and service in our optical departments, our hearing aid centers, and our pharmacies. To build script count, there's different script counts. People might not always realize that optical has prescriptions. And so a big portion of what we're doing is making sure our patients are getting their annual eye exams, and a year later are they utilizing the contact lenses they got from us in the proper fashion. Same thing in pharmacy. Medications, are they taking their medications correctly? If you look at patients today, on average for maintenance medications, they only take their medications for about 5.8 months per year. They should be taking them permanently on an ongoing basis. It's a huge problem in the country with people not being compliant and persistent taking their maintenance meds. So the great part about Sam's Club, and the rest of Walmart also, is with our low cash prices, the fact that we take most major insurance plans, including Express Scripts and Humana plans, and the technology and the clinicians we have, we can help people start on their medications and stay on their medications. And when you look at people who have diseases that require maintenance medications, it's not just a drug, not taking it one time, it's a complete care package. And so if you look, we'll just take diabetics for instance. Diabetics are supposed to take their medications every day, on time, without fail. But if you look even for diabetics, they only average about 6 months a year on their oral diabetes medications for our type 2 diabetics. So if we just did that, we got people to take their medications the correct way, that would be a great victory. But on top of that, if you look in our building, you're right, we have doctors of optometry, we have opticians over there. Diabetics, what else are they supposed to do? Supposed to get their eyes examined at least once a year, because the incidence of eye disease and other diseases are much higher for diabetics versus the rest of the population.
Last up, Angie Muldoon, Director of Business Development for Health and Wellness. Angie talked about how the work her group does is helping to connect the dots between Sam's 3-tiered health and wellness strategy.
Our role in business development for health and wellness is to do exactly that. It's to focus on the strategy, prevention, awareness, and solutions. And the best examples of how we do that are with our health screening events and our new Healthy Living Made Simple magazine. So specifically with the health screening events, we focus, and it hits all 3, prevention, awareness, and solutions, because our health screening events, we've done over 1 million in 2011.
Wow.
And which we're very excited about. And they are on a variety of topics and available to our members so that they can figure out how to prevent. It's everything from glucose to blood pressure to cholesterol, and then with that information they can make the right decisions for their own health. So certainly then on awareness, our screening events actually are available not only to our members but to the general public. We do that because we think it's important to drive awareness of their own individual health, and whether they're a member or not, and then also to drive awareness of our OTC, pharmacy, and HBA areas. For that reason, we house our screening events right in front of that area of the club. We do that, of course, in all of our clubs that have a pharmacy. Okay. And then lastly, with solutions, what's so important to us is that now we've given them this information and we've armed them with it, we need to provide them with solutions. And so what we do is enter into relationships with our sponsors and other vendors and suppliers to then help us show those solutions that are relevant to that particular health theme. So in March, we actually did free allergy screenings. Wow. So with a blood stick in the club, we're able to then send that member information about whether they happen to be allergic to the top 10 allergens. In June, what we're going to do, which we're very excited about, is men's health, centered around Father's Day, and we will provide free PSA screenings. PSA stands for prostate specific antigen, a very high value test and a high quality test. It gives men kind of a precursor idea if they need to go on and see a physician.
The newest initiative to come out of Angie's team, Sam's Club's new health magazine. With a total circulation of 8 million, Healthy Living Made Simple is the biggest health magazine in America.
The first issue launched in January. It is a bi-monthly 68-page magazine. It's what we thought was really important. We asked our members and said, what do you want to know about health and wellness? And what we really learned is that our members define health and wellness in a broad way. They, every member defines it a little bit differently, and it's not just OTC and it's not just pharmacy. It's fresh and it's beauty, and it's so many other areas of the club. And so what we thought would be important is to take the magazine, focus on general health themes each month, do it bi-monthly, but then tell them things about the tips and tricks for all of those different topics.